We have talked about treatment of pain and other physical symptoms. We have talked about emotional issues, social issues, and spiritual issues. You may now start wondering, how can a doctor address all that? You may have to see a large number of patients every day. There are primary health centers in Kerala where every doctor has to see more than 100 patients every day. And where do you address psychosocial spiritual issues there? Well, I have two answers to that question. Yes, we have to be realistic and do only what you can. But even if you only have a minute with a patient, the way you do things makes a difference. Within that minute, if you convey to the person that I care for you, that person will feel so much better, your relationship will be better, his well-being will be better, your satisfaction will be better. That's one thing. But in addition, among those 120 patients, there may be one or two in whom you feel, look, there is something wrong here. This person is looking as if the whole world is resting on her shoulders. There is some problem. Then you may say, I see that you are in severe distress. I am sorry that I do not now have the time to go into it. But could you get your lunch and come back at 3 o'clock? I would like to talk to you a little more. If you can find that extra time for those who need it more than others, sometimes the results can be fantastic. Like you may actually save lives. Human beings can be saved by that extra attention. Generally, what we have been talking about is giving whole person care, so rather than just diseased focus care. I'll stop by just pointing out that all this is not relevant to one corner of a hospital, the palliative care unit. This is about healthcare as a whole. In 2014, the World Health Assembly passed a resolution saying that palliative care should be an integral part of all healthcare. India in 2013 came out with the National Program in Palliative Care, NPPC, which again makes palliative care a part of healthcare. I know there will be a gap between policy and implementation, but it's happening.